Welcome back to another episode of the Health Me podcast, episode number 68. Welcome back to another episode of the Health Me podcast. This week, I'm really excited to share with you my conversation with the physical therapist for the UFC. Combat sports has grown immensely over the past decade, with more and more gyms popping up and fighters attracting larger audiences. With larger audiences, many professionals from trainers, coaches, and rehab have all tried to learn more about the sport and how unique these athletes are. Because the nature of the sport is to cause, harm. It was interesting to hear from our guest today about how she manages fighter injuries and even hear her perspective on pain for one of the most violent sports to date. Additionally, we discuss the importance of athlete confidentiality, biologics as it relates to healing injuries, and how certain aspects of injury management in the UFC can be translated over into traditional orthopedic and sports rehab. Our next guest shares some amazing stories, including how she was able to help Francis Ngannou prepare for his championship fight, how she got involved with combat sports to begin with, and her previous experiences working with Olympic athletes. It was a true honor to have her on the podcast, and links for her information will all be provided in the show notes. Please enjoy my conversation with Dr. Heather Linden. Well, I'm excited to have you, and I'm really excited about our conversation today because there's so many questions I do have, having worked with some combat athletes myself, and you're working with the UFC as well as at the Performance Institute in Vegas. But I kind of wanted to get everyone on the same page and kind of bring them into your career. And early on, you had been working with a lot of Olympic athletes, and as an early physical therapist, you're kind of this rock star. You're working with Olympic athletes, and you got presented with this opportunity to work with the UFC. And from my perspective, it would be like, I don't know if this is like a good opportunity. Is this a good career move for me? So maybe just describe, what was going through your head early on, and what ultimately led you to decide to work with the UFC.
So I had spent about 6.5 years at the Olympic team and really got to see what a performance team looks like, right? So being able to integrate with not only different clinicians that are in sports medicine, such as chiros, massage therapists, athletic trainers, physicians, physician assistants, but also got to work with, strength and conditioning, sports psych, nutrition, all of that kind of stuff. So I was really fortunate from the Olympic standpoint to be able to integrate with a whole performance team when we would collaborate on athletes. Though in all cases, there is some things that don't always go as smooth as you predict. So definitely found out there was quite a bit of silos and just, some of that red tape to get through when you were trying to do these integration meetings and things like that. So when I received a call from a recruiter for the UFC, I honestly didn't really know much about UFC. I knew a lot about combat sports just because where I was based in Colorado Springs, most of our combat athletes live there full time, but I really didn't know how it integrated into UFC. So speaking with Forrest Griffin and speaking with a bunch of the team that had already been there, there was so many similarities to the combat world. So I think what really stood out to me the most and realized that this was probably an opportunity of a lifetime was when they said, name your brand, do what you want to do. So I've always thought that we have not been the best clinically to our professional athletes. I was able to see Olympic athletes that were number one in the world that maybe had one bad competition and slipped down in rankings and then not have the services anymore because of funding and, limitations. So I've always, I've worked with other professional athletes and organizations where, there's just silos or you don't have the time to spend with an athlete. So when UFC gave me this opportunity and pretty much said, you get to develop your sports medicine facility from the ground up, exactly how you envision it and how you think a performance team should be, it was nothing but, an absolute yes on my side.
Well, how did you develop the skills to, build a team? I mean, as a physical therapist, I have that opportunity. It's often you kind of, like you said, you get in these silos, you work with maybe just you see your patients, but you don't get to work collaboratively. So did you have any maybe imposter syndrome early on where you thought about I'm afraid that I might not build the right team?
You know what? I was never afraid. I mean, I definitely think it was a little bit intimidating in the sense of like, okay, how are you going to build this team and be successful? And I think also having the experience from the Olympic team, I saw what worked and didn't work. So I could pull what I had learned so far and then, go out there and, envision exactly what I wanted. I knew that I wanted, in the sports medicine department itself, a very integrated, interdisciplinary where we have all these medical people collaborating. I mean, so many times we get oh, they're the physical therapist, they're the chiropractor, they're the athletic trainer, but people don't even know that most of our, education is very similar. There's little bits that differ between all of us in sports medicine. So it's actually nice when you mold a team together, you get to learn from each other and learn the little pieces that maybe you weren't educated as well in. For instance, I know from adjustment standpoints, in physical therapy school, we learned pretty much one way to do adjustments on each joint. Well, in chiropractic school, they learn a lot more. So, I've been able to learn from my sports chiro and go, oh my gosh, I'm a little person. I can now do adjustments a lot easier because they were taught just different ways of hand motions and things like that. My athletic trainer is so good in emergency medicine, bracing, taping. I've been able to learn a ton from him. So I knew I wanted that integration with people collaboratively working together and only building each other up professionally. So when I had this opportunity, I, jumped on it and I was pretty much, full speed ahead as soon as I started.
I hope that other institutes listen to this and realize the importance of collaborative practice, because it doesn't always seem to be the case. It's only these in the extreme situations where we have professionals who are, like-minded like yourself, who think about how other clinicians can really bring value to the table for athletes. And unfortunately, even I'm sure you saw this with Olympic athletes where you said they get put in these silos and maybe they're not. Maybe they had a bad, year or bad performance at the games, and maybe they didn't get the recovery that they needed. And hopefully, this is something that continues to be pushed out there, so more people and more athletes can actually benefit from all the providers.
And I think it needs to even carry out further from even not just the athlete population, but general population. Like we can't expect a body to heal at its best capabilities if we're not fueling it the right way, if we're not sleeping the right way. All these things factor into success of injuries, rehabs, and things like that. So why we're not integrating more physical therapy clinics out there is beyond me.
Yeah, absolutely. Well, let's get back to the combat athlete, because this is certainly something that, not, people are learning about. The UFC is a very much a growing sport, and it's something in all our eyes, it's very interesting because never before, for many of us who are, probably younger than 50, 40 years old, this is a brand new sport. So was there a learning curve for you to connect with combat athletes, and were the athletes in combat sports completely different than anything you've seen before?
So they are definitely a unique population of athletes. Pretty much if you tell them they can't do it, they're going to go do it and they're going to do it to the best of their ability. So I guess when I first started, I would say that my physical therapy clinic really had the big red X on the doorway, right? Like athletes were really concerned that I was going to pull them from a fight, right? Like hide the injury, don't tell Heather because we need to get to the fight and go from there. But really what they didn't realize that I come from that Olympic background, which is so unique. So I've seen athletes train their entire life for one day in their entire lifetime. They devoted everything. And I know how important it is for them to make it to that day. So, there was times we had an athlete that tore her ACL in Olympic trials, but she won Olympic trials. So of course we rehabbed her without getting the surgery in order to be an Olympian, because that was the one thing that was her goal, to walk down and claim that she was an Olympian and be able to compete at the highest level, even if she knew it wasn't going to be her best effort because of the, newly ACL tear. Where I look at our fight world exactly that same way. Our fighters don't know when their next fight is going to be. There's a lot of things that go into it, right? Whether the matchmakers, whether injuries, whether family stuff going on. So each fight to our athletes is almost like an Olympic day. So I think once I started to build that trust and, realize that like, hey guys, I actually can help those injuries and make sure you are, the healthiest possible walking into that octagon. And if you do have some injuries, we can work with them. There's a lot of things we can do as physical therapists in order to make those injuries, successful and be able to still compete. So I think initially I had to learn that, first I had to develop a lot of trust with these athletes. And one thing we did is we got on the road and started like being available during fight weeks. And a lot of times, fight weeks, we might just do flushes. And, some physical therapists or other sports medicine clinicians might be like, I was trained way more than to just do a soft tissue flush, hour on hour on hour. But when you start doing that and then they start trusting you and saying like, hey, my shoulder actually is a little tight. And you're like, hey, what's going on with that shoulder? Okay, well, I have a labor. You know what I mean? You start to learn everything about them and their body and gain that foundational trust that you need. And then they realize, hey, you're there only to help them and only, be words of advice. There's so many times these athletes, because it's a new sport, haven't had a medical provider to guide them and help them. Is something a chronic injury, acute injury? Is this something that, we can just do a certain technique and the pain will go away? I think my first time working with a combat guy, he came in for a fight week and was like, I can't feel my arm. My fingers go a little numb, but that's normal. That always happens when I'm grappling and I get a little bit of a stinger if I shot in and my head went this way. I'm fine. I'll be able to compete. And I'm like, well, we can actually get rid of those symptoms so you compete. Right now you're saying you can't really lift your left arm. It's achy, everything like that. Like, let's fix that. And we were able to work with him the whole week leading up to the fight. And then he had no symptoms going into that fight. So I think it's just breaking down those walls and gaining the trust of combat athletes for them to really understand that we can be a huge asset to them.
So establishing trust has to be, the absolute most crucial thing possible, right? Because if you don't have trust, athlete's not going to buy into what you're saying. And of course, then you can't really do your job. So was there something that you had to learn, maybe communication wise, or you had mentioned that you just being there was really important and just being like, hey, like I can show you something. Was there anything else that maybe you learned along the way that helped you to be more communicative and build trust with the athletes?
So there's two things I think I've learned from that. One is good communication, right? Not only with the athlete, but the coaches, the strength and conditioning. I mean, we have athletes globally around the world. So opening up that door of communication with, hey, coach, can we do a little bit of this and just avoid this one movement for a few days until I can make a progress that I want? One thing I've always said to the athletes, like, I'm gonna do everything in my possible means to get them through that fight and healthy as they can. So, you got to work with the athletes. One thing I've found that works really well, some people will come in and an athlete will be injured and they're like, hey, can I train? And immediately the clinician's like, no, I need like no training, no this, no that. These are combat athletes. They are used to pushing their bodies to the limits, maybe having aches and pains when they wake up. So it's not whether you say, hey, you can't train. It's okay. Let's give and take. I'm going to let you train this, this, and this. So let's just do some striking, some mitts today. Can we hold off on the grappling aspect? So understanding the sport and realizing in this sport, there's so many avenues of various sports that are combined. So find what the athlete can continue to do so that they don't go crazy and then they don't want to come with you because they think you're going to pull them from training and fight. And how are they going to cut weight? Come up with solutions that you can give and take, and then make sure that they can still do things that, stimulating their mind and they feel like they're not missing a day out on training.
How have you developed the skill to identify like this is a issue that is going to prevent the athlete from, performing at their best? You're going to be fighting somebody in the UFC, right? Like the objective goal is to literally knock somebody out with your body.
Right.
So how have you developed in defining this line of like, this is something that we can, deal with and maybe we can figure it out after the fight versus an injury that it's like, okay, we really should push off or lay off from this so that way you don't further injure yourself and get in the octagon and hurt yourself even more?
Yeah. So I think, one thing first is getting as much objective information that you can about this athlete, right? So, we really pride ourselves in objective information. So we're doing really thorough evaluations, histories. We're using data like force frame information, Biologics, functional testing. We're working with our strength and conditioning coaches. So we pretty much can map out and objectively test a ton of things going on right now. We have force plates, we have force frames, we have everything you can imagine. We're very lucky from a facility standpoint. But what we need to do then is, really talk to the athlete and the coaches. I think the only time I've really seen an athlete us agree like, hey, let's pull out is if that athlete can't train to their fullest, right? Like an athlete knows they're this is the best way they can win, right? In that sport, right? Like, hey, I know this athlete's a grappler. I need to be able to defend takedowns. Or, hey, this athlete's a striker. They do this, that, and the other. So it's, if they can't do and prepare the way that they want to prepare, and they don't feel ready because of the injury, or because they've had to take time back to fix the injury, that's when we have that good group conversation with the coaches. I can honestly say, I don't think I've ever really pulled an athlete from competition. I have met with the coaches, met with the entire strength, nutrition, sports psych, everybody, sports science. And then we've collaboratively came up with like, hey, is this the best idea? For like your future. Like, if you go in and you can't compete because of this injury, or you can't grapple because of this injury, and those are your best tools, then why are you setting yourself up for failure, right? So, let's look at, is this fight worth it? It's a very different situation if it's a possible title fight, right? Like, you look at Francis Ngannou, right? He had an ACL and an MCL tear. It's very, he went very public with that. And we knew 4 weeks out that this had happened. But we were able to push him in the rehab, use all the technology and all the modalities we had, and then also collaborative with the coaches and the strength coaches to make sure he wasn't missing out. And those last 4 weeks, we could focus on those injuries and make sure he was, the best he possibly could be. And he won a world championship. Some people might say, I would have pulled that fight, but when you have an athlete and I'm having them with a BFR cuff, jumping, doing all different kinds of functional testing and them looking amazing, I'm going, why would we pull this athlete from this fight, right? Like, I can't make this athlete fail in all these different capabilities. Like, let's move forward. Let's do this.
Yeah, and for those who don't know who Francis Ngannou is, he's a heavyweight fighter in the UFC, and he's a very, very he's a very big human. He's about 260 pounds, and he's very strong and very dynamic. And I remember watching that fight against Cyril Gane, and it was unbelievable, the fact to think that he had an ACL tear during that entire fight.
Yeah. And MCL, like 2 ligaments, right? And I think that's the coolest thing about working with combat sports, is you really have learned that you can push the body a lot more than you think to the limits. So many times an athlete or someone is injured and we immediately go to, oh, well, that's a surgical candidate, go do this. But I can tell you, we're definitely pushing the limits at the PI, and we're definitely finding that some things can hold off on surgery, or, there might be a different avenue of orthobiologics or something like that that could get that athlete through, and they might not even ever need surgery. Currently, we have a ton of athletes with labrum tears, and we've been using, orthobiologics, stem cells, hydrogel, hyaluronic acid, those kind of things, along with really good physical therapy. And they're really avoiding surgery, where before they used to immediately go down that avenue.
This is an interesting conversation, because obviously, from even for myself, I've seen athletes before where I'm not 100% sure, like, this is someone who maybe even needs an ACL surgery. Maybe they're, in their 30s, and they're really, really strong, and objectively they look really, really good on paper. But for some people, maybe from a surgeon standpoint, or even from somebody who is an avid runner, like, well, what about my long-term effects of, like, not having an ACL? They may be thinking that, well, these MMA fighters are elite, like they can handle not having an ACL or an MCL in their knee. Maybe speak to, like, what would you say to that? And, like, what are you seeing in regards to how the human body can adapt from injury, even though we have this kind of conception that if you tear it, we got to fix it?
Yeah. So, I mean, I think it depends on obviously the mechanism of injury first and foremost. Like, if you have a traumatic ACL or a traumatic ligament tear where the leg blows up extremely, you get, the inhibition of the muscles that are around that area and everything like that, then that could be a different scenario than if it's a small gradual, injury over time that then finally tears. And that's definitely what I think I'm seeing with our MMA athletes is, the mechanisms of kicks and things are very much the same mechanism of injury, right? Extension and rotation of the knee. And I think they're happening over time, because a lot of my athletes will get these, they'll feel a pop in their knee or a pop somewhere in their joint and be like, oh my gosh, this is torn. And then they won't get the big swelling, the muscle inhibition. 2 days later, they're walking around, they're starting to train and hop again. And you're like, wait a minute. So, I mean, it definitely shows us that, the body over time can adapt. It also shows us that if you have really good stability around that joint, whether the muscles are really strong around that joint, there are ways that the body can adapt and actually have no problem doing the functions that are called upon them. I mean, I think it's pretty amazing. I have a surgeon here in town who's a knee surgeon, really good knee surgeon. He used to work with USA Ski and Snowboard, and now he's in Vegas, so he sees a lot of our UFC athletes. But he's to the point where I've had athletes fly in. I will do all of our diagnostics and functional testing with them. And if I can't find any reason for them to have surgery, I will refer to him and he'll do his testing. There's so many times he's called me and he's like, I don't know what you guys are doing over there, Heather. I don't know what these athletes are doing, but you're right. I don't think they can continue their career and not get the surgical inflammation right now. We can do it. I mean, like you said, general population versus athletes careers are only for a certain period of time, right? So if you're taking a whole year out of that to rehab, rankings change in combat sports, maybe their window of opportunity changes. Maybe they're on a really good run, mentally they're in a good spot. So all of those are going to fall into place and change. So I think it's considering everything, looking at the injuries in front of you, doing objective testing to see, whether that person can get away with it, and also possibly trying the conservative means. I say a lot to my ACLs, like, give me 4 to 6 weeks of, let's do some orthobiologics in there, and let's do a lot of really good physical therapy. And in that 4 to 6 weeks, if you can't go out there and perform, then we know you need surgery. For instance, I had an ACL athlete that literally tore his ACL. We did, and I tell this to athletes prehab, right? Like, a lot of times they're worried about getting surgery initially, but if you go into that surgery with less inflammation, better range of motion, and better strength, your outcome is even going to be better. So you're really not missing out on any time if you're doing that prehab for 4 to 6 weeks. And then you can really test it out. So this athlete literally went back to full strength and conditioning, full training, was doing great. And he's like, I don't know if I should have surgery, Heather. And I said, this is what I want you to do. I want you to go spar. I want you to go do the hardest thing that you need to do, like you are in a fight. If at 1 minute you hesitate because of that injury, or you can't perform something that you would normally perform, then you're going to need surgery. Mm-hmm. And that's how we looked at that. And he went out there. He's someone that kicks a lot. His lead leg was his ACL leg. And every time he went to kick, he said when he was sparring live, he hesitated. And I'm like, you're in a sport, you can't hesitate, right? Like, that's when you get knocked out. So it's one of those things where, we made the decision for him that surgery was the best option. I've had another athlete that, was doing backflips off cages, was doing all this crazy stuff. And they literally were like, I don't feel anything, maybe he was someone that didn't need surgery. Like, it all depends on the athletes, and it depends on kind of how they, perform and what kind of tools that they use to get to that level.
It's so interesting because it's like against a lot of what the norms are. And how do we get maybe what you're learning and what you're doing with these UFC athletes maybe into a more sports ortho population, and some of the physical therapists that are doing ACL rehab across the country now? It may not be the same, but maybe what are some things that you've pulled together in addition to athlete preparedness that you think will be important for maybe this transition to happen?
Yeah, I think what needs to happen is, first, really good understanding of what the sport needs are. If you are maybe an NFL player and you need to run and cut, maybe you do need that ACL for that. So that might be a very different instance. If you're a different kind of sport, that maybe cycling or something like that, that doesn't need that stability. So I think first you need to know what the patient's, plans, goals, things that they want to do in the future. And then I think setting them up for as much success with using the new technology we have, whether it's, we use Shockwave because it's really great with enhancing recovery and improvement of ligament injuries and things like that. We also use blood flow restriction, in order to build the girth of those muscles so that they're stabilizing and they're returning back faster. So using all the tools that we now have as clinicians on top of understanding the sport and what that athlete's needs are, sitting down and asking the athlete, like, hey, how do you win your sport? What are, what characteristics or what things do you need to do in order to perform your goals, right? Whether it might be a weekend warrior that's just running and biking, right? These could be things that could also, with good foundational strength, that they might not need surgery. And I also just think, trying the conservative treatment first, in the past, we've been so quick. If something comes back on a diagnostic image, oh my gosh, we have to fix it. But I mean, if we were to use diagnostic imaging on the entire population, we'd see everybody has a disc herniation, probably labrum tears galore. I mean, we do to our bodies every day, we're gonna have degeneration. We're gonna have things that break down. Even if you're someone that is, not very active, you're still sitting, you're driving, you're doing things posture wise that are all gonna break down. And so I think it's, educating the general population and the athletes of the importance of, the body will have changes over lifestyle, make the body the best it possibly can, build that strength, build that foundation, counterbalance with what you're doing, whether it's from an athlete standpoint or just the general population. And I think understanding that, and as clinicians, pushing the limit, not being afraid to say, hey, doc, like, I can't make this person like be unstable, or they can't do any of this. I laugh because recently I have a family member who's a doctor, and other family members that are physical therapists as well. And someone close to me messaged us a picture of an ankle. It's swollen in black and blue. Immediately, the physician of the family was like, you need to see your GP. You need to go get an x-ray. The x-ray will be red. Then you'll go back to an ortho. The ortho will then maybe boot it and see. And I literally just named, the Ottawa ankle rules. I said, hey, can you walk? Yes. Can you hop on that foot? Yes. Is your malleolus tender? Is your fifth metatarsal? No. I'm like, you're fine. It's a bruise.
Yeah.
Like, and so go back to what our foundation, I mean, we all know this as medical providers, how to be good diagnostic, like experts, and go back to that. And besides just jumping down that chain of like, what's the easiest, and, just go send them off for x-ray and imaging. So I think it's really learning to be a really good expert in diagnostics, and then taking that and applying that to everybody.
Well, I think it's unfortunate a lot of the times that what we see in, high level sports doesn't always get translated to the general ortho population. Like you said, like the amount of times that I've had patients come in and be like, well, I hurt my back. And then like the same story, like I went to my general and then they didn't have any explanation to me. They referred me to the ortho, and then they told me to relax and do nothing for 3 weeks. And then they're like, okay, try PT. And then I don't see them 2 months later. And it's like, we could have been halfway done with your rehab by now. And but getting back to what you wanted to do.
I mean, I had an NFL player last night that I saw, and literally had an injury in their training camp that, yesterday morning. And literally what he told me is, the medical team did ice and stim on it. And that is so old school. Like, take out the shockwave, take your hands out, do soft tissue, make the fluid go out where there's a bruise in the muscle, do range of motion. We did an hour session last night, and he walked out of there with no limp, no nothing. And it's just like, come on, guys, we're better than this. As clinicians, we know like good manual skills, all the capabilities we have, and all the continuing education we have, the capabilities of learning, take those and then do something, make a difference.
Absolutely. Well, you mentioned a lot of tools, and one of those things you'd mentioned was Orthobiologics. I'm not very familiar with, not the efficacy, but just the use of them and like how they've been responding. But perhaps you can speak to, have you seen a large improvement in how people respond to some of these orthobiologics in sports?
We really have. So I've seen, so if people that aren't aware, orthobiologics is, you're going to have different tools in order to make the body heal, right? So we use PRP, which is your own blood, to spin platelets and re-inject that in. We use stem cells, which there's 3 types. We have embryonic, fat, and bone type stem cells we can use. We use hylogel, which can be stem cells, hyaluronic acid, and a compounding component there. All of this stuff is kind of new age. I would say, PRP has been around, but the rest of the stuff is kind of just now getting hot. You'll hear people go to different countries and get stem cells and things like that. It just depends on what kind of stem cells you're getting and the efficacy of it. In the US, the FDA, we have a lot of, things we have to get through in order to get these things out to the general public as much. But we are seeing that we're using these a lot from any kind of cartilage, ligament, connective tissue issues that we're finding. We've used a lot of the orthobiologics and then throw rehab on it. And athletes are doing great. When I first started, I can't tell you how many labrum surgeries I first saw, because we are an overhead sport, right? But now we're seeing such a good response to orthobiologics and then physical therapy that majority of them don't get labral repairs, which is pretty amazing. Because I mean, the demands of what they're going to need to do with overhead athletes and not getting that repaired, they can do a lot of wear and tear. But we're finding that with orthobiologics and good physical therapy, you can hold off on a lot of the surgical repairs.
Are there any indicators that maybe somebody will respond more positively than another?
Yeah, I mean, I would say initially they're going to feel almost worse. Like you're going to have a first few days of, because you are generating a huge inflammatory response in that area. So they're going to feel like that joint is really full and full of fluid, swollen. But honestly, if you see them get range of motion really fast and the pain decrease, that's going to be your key indicator that you can continue to push range of motion and strength. I would say the biggest thing is if the activities of daily life go away and they're not painful anymore, then it's going to be a success. So that's kind of my thing that I always tell athletes. When I see a labrum surgery or a labrum tear, I will be like, okay, when that gets to the point where you can't do your ADLs of picking up a mug, sleeping, that's when probably surgery is necessary. If you feel it with a motion overhead, just throwing a punch out really far reaching, that tells me we can gain some stability. So listening to where they're having symptoms, I always say if your basic fundamentals of living start to be affected, that's probably when surgery is a necessary means. If not, then there's a million things we can do to get you through it.
Which is awesome. And, it seems like you guys have put together a great organization as well as built up a large, tool base to kind of create the best environment for these athletes. Because again, these guys are going to all war at some instances, and they're really putting themselves into the most extreme versions of how to injure themselves, basically injury 101, so to speak.
Job security is definitely great for my husband.
So if you're having a problem trying to find a job, make sure to get in combat sports. You always have people coming for injuries.
Absolutely.
Have you ever felt any pressure to get somebody back to a fight, or, you have all these tools and things available to you. But do you ever feel maybe a pressure to get somebody better sooner, or just from a professional standpoint? I know in my position as or in orthopedics is not, there is pressure, but not nearly as much as like, we need to get this guy ready for a championship fight. Then he's going to go up against this other 260-pound guy who's going to, he's coming to kick his ass. So I guess, like, do you ever feel a lot of pressure to get somebody as good as possible?
Absolutely. I mean, for one instance, I had this athlete that I really wanted to prove. I mean, we're still very new from a performance standpoint. So we still have a whole company, right? UFC has been around now 29 years, and we've only been around 5. So the performance side is only 5 years old. So, initially when we started, the rest of the UFC wasn't really sure exactly what we did, right? So there was always that like, hey, I can possibly save a fight. I mean, we were hired because there's 2 reasons fights don't happen usually: nutrition and they don't make weight, or an injury. So we were hired specifically to prove a point of, hey, we can decrease the amount of fights that are lost during the year, which then increases our revenue, right? And everything like that. So there's a huge pressure on us. And, a lot of times I remember once early on, I had an athlete come in and confided me about an injury. And I was like, okay, let's try to rehab this. And literally the athlete's like, I want to go up until like the week before. If I can't, then I'm going to pull out. And I was like, okay, that's fine. Let's do this. And I remember getting a call from one of the matchmakers when the athlete did eventually pull out and being like, I heard you knew about this and you didn't tell us this whole time. Like, you're the UFC. Like, but I really hold dear to me the trust of an athlete. And if they ask something of me, 100%, I put them first. And I will, work with them to try to make that happen. So there's always, a little bit of that, really trying to be on that athlete-centered model and really, confiding in and having the trust with the athletes. And I will always, give them as much of a shot as I can so that they can, support their lifestyles and their family and everything like that.
Absolutely. Well, another part of it too is like, how important is it keeping injuries away from maybe other athletes? And I know you had mentioned Francis, he had publicly made it aware that he has an ACL injury, but to another athlete, they may want to keep that a secret because it may give the opponent kind of like like their knees bothering them, I'm going to go after that calf kick, or like, oh, their labrum's bothering, I'm going to go after that arm bar. So I guess, like, how important is it to keep injuries away from other athletes?
Very, very important. I mean, not only do we have a private treatment room, so what's interesting is in the Francis case, we have a private treatment room that's always available for an athlete. So, his first day coming in, we took him into the private treatment room to do his diagnostics and to do his, evaluation. And then after that, asked him, hey, do you want to go? And he's like, no, 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 no. These are my friends. These are my friends. And it's actually interesting because then after the fight came out this big article that, the PI wasn't this secrecy, and, odds changed in Francis's. They found out about the injury. And I was like, well, I literally was in the underwater treadmill with Francis, and like 6 athletes come in and his coach comes in and they're talking all about the injury. And I mean, I'm like, do you know how many, like, Francis had every opportunity. We would even said we could shut down like an hour of the PI just to, like, we're very much aware that keeping injuries secretive, having the athletes trust is our number one priority. So like we can close down an area of the PI. There's times I've come in the evenings and just made it a closed door where I'm just there with the team. We also always have the capabilities to use a private treatment room if an athlete needs to. But I mean, all the time we're asked to keep kind of, that information away from anybody else. I mean, it's even as crazy as, I had an athlete once, this was hilarious, and I was working on their foot. They had a fight coming up and their foot was really bothering them. Well, I noticed that the manager came in of the opponent because he came to see another one of his athletes that was in there. And so all of a sudden I just shifted and I went to the other foot, and I took my phone and I texted the athlete and I said, just go with it. I'm going to work on your other foot. And the athlete looks at me and goes, why'd you just text me, Heather? Like, I'm like, oh my gosh. And then finally, like, that the manager left and I was like, that's the manager of your opponent. Like, I want to make sure that he doesn't see and say, oh my gosh, Heather was working on his right foot. So if I work on the left foot, then what are they going to say? Oh, both feet. You wouldn't know.
Right.
So it's being very mentally aware of your surroundings. I mean, I died laughing because the athlete's like, my other foot's fine. And he's like, I don't know why you're texting. I'm like, oh my gosh, you're killing me, Smalls. Like,
You're doing him a favor and he's over here like exposing you.
I know. And I was like, I'm trying, but we're always aware of that. And we always are aware of making sure that, athletes' privacy is our number one, concern. And we're always, trying to be, athlete centered.
Do all the athletes use the Performance Institute? I know there's a lot of championship fighters who may travel, work out overseas, or maybe they get outside resourcing, but I guess how many athletes do use the UFC Performance Institute?
So right now we've had 700 athletes come through the Performance Institute and use it at some point. We have a roster of 600. So, that roster changes, right? We get athletes that are cut. We have new athletes that come in. Every athlete has the opportunity to dive into the UFC Performance Institute. We have our facility in Vegas and our facility in China, and we're about to do another facility in Mexico. But that being said, there is athletes that are training in New Zealand and Australia or other places. And, we're there during fight weeks and we get to meet those athletes. An athlete might come in and just get a full workup of all diagnostics from every department. And then we'll collaborate with the people that they're working with, whatever country they're in. I mean, one thing that I can say that's very different about the UFC PI is we share all of our information. Other professional organizations, Olympics are like, oh my God, keep our information really close to our heart. This is the secret, recipe that works. With us, we're trying to better MMA. We're trying to evolve the sport of MMA. So not only do we give the athlete their private information and they can take it and work with whoever they're working with, but we're also if there's general knowledge that we're learning, we're sharing that. We're starting to do podcasts, we're doing classes, courses, because we really want the evolution of MMA to change. We want it to be at that same caliber as the rest of the professional organizations, because we are definitely on that uphill battle. And we're definitely an organization that, is getting a lot of attention.
Absolutely. Well, did you think that athletes are getting in more fights throughout the year because of this? Or do you think it's kind of similar or maybe never change?
So I would say that athletes are staying more healthy. I would say the biggest change I've seen in UFC and in MMA is that when I first started, an athlete would do an 8-week fight camp and then they would disappear. And then they, when they got the next fight, an 8-week fight camp, our athletes are now becoming year-round athletes. They're staying engaged, they're staying healthy, they're staying near closer to weight, where before it used to be this big bouncing of fight, stop, they don't do anything. Fight, stop. And now it's like a year-round actual athlete. So we've seen that transition significantly changed in these last 5 years, which has been amazing because now we're being able to work on those chronic things or little things that will make them a better athlete. Where before it was like, they'd come in and be like, my back always hurts during fight camp. And I'm like, well, what are you doing when it's like, I can put a Band-Aid on that and get you through fight camp, but like, let's fix the problem. Let's go to the root of everything and fix it when you're not in the fight camp and trying to work technique and, all your game plans and things like that. So athletes are definitely transitioning to a more year-round athlete. They're being a lot more aware of what requires them to be an athlete and just building on that. So it's pretty cool to see.
Yeah, well, it's great that you're able to see them year round. Is there anything maybe you've taken away having seen athletes now year after year after year versus, just doing the 8-week camp and then seeing them twice a year for 8 weeks in short bouts?
So we're definitely able to identify more of those chronic injuries that the athletes are coming and developing preventative programs for those athletes in order to make them not have these chronic injuries. We're also seeing that, athletes are able to fill in little bits, understand of recovery, understand self-care and things like that a lot better. So I think in the overall, they're being less injured. They're able to, take care of the issues that are coming in up during their fight camp so they don't rear their head back up again and they can just have a nice smooth camp. And then they can focus on technique and game plan and things like that rather than, oh my gosh, I can't punch because my left shoulder continuously hurts. So it's just a lot better of a place to be. And I think, you're seeing the evolution of this MMA athlete happen.
Well, speaking of chronic injuries, one thing obviously that is very prevalent probably in the UFC is concussions. And, many people get hit in the head. Is there anything that you've learned maybe about concussions, or is there maybe some insight that you found working with combat athletes that get frequent concussions?
So, unfortunately, one thing with our athletes is they're independent contractors. So, even though they might be diagnosed with a concussion, they don't have to come through the PI and do the return to play concussion protocol. One thing that's really cool is we have developed a return to play protocol that actually also includes strength and conditioning, nutrition, sports science, sports psych. So, I don't think there's anything out there that has an interdisciplinary concussion return to play protocol, which we utilize. I will say that unfortunately, like we do have a lot of baseline testing that is going on. We have about 300 baseline neurocognitive screening tests that are performed on our athletes whenever they come through the PI. But being able to follow back up on that, you have some athletes that are great. There's a group in Boston that literally follows our return to play protocol step by step, and they do the same C3 logic testing. So I'll send the baselines to their clinician that uses that system, and we can go back and forth and make sure that all the parameters are back up to par before they start any of their training. So that's in an ideal world. I would say for us though, because athletes, the knowledge about concussions and things like that was not out there when we first started. I remember the first time I took an athlete history, I asked the athlete, had they ever had a concussion before? And one thing they were like, nope, never had one. You go back and you look at their previous fights, right? And they've had 3 or 4 knockouts. You're telling me not one of those knockouts was a concussion. But right now, the athlete's an independent contractor, they might get diagnosed by the physician that's at the ringside. And then after that, it's up to the athlete to, find that return to play. Now with the amount of knowledge, I just had an athlete pull out and reach out to me immediately and say, hey, I want you to send me the return to play. I want nutrition to send me the supplements. I want to get on a call with my strength and conditioning coach so we can do a Buffalo treadmill test and things like that to really guide the return to sport back. Because, that is a concern. We want to make sure that they are at their healthiest. All the information, concussions, the new buzzword, right? Everyone talks about it. So it's one of those things that we're just doing as much as we can. We also have partnered there's a group in town that has some like posturography, audio, just some audiology, things like that, eyesight, everything. So we kind of put this really big composite of a lot of information when an athlete has concussion to make sure that we're treating it like you should. Just like if you had a knee injury, you'd probably treat it in a certain way that you've had success. Same thing with the brain, right? We know it's very moldable. We know that there's a lot of things that can repair itself in the brain. So being able to guide that concussion and make sure that that's being treated just like we would treat a body part.
Now, just because an athlete gets knocked out, does that mean they got a concussion, or do you treat it like a concussion, or how do you look at that?
So, I mean, that's a great question because I would say I don't have the concrete answer, but I will say this. I've seen both. I used to always think that if an athlete got knocked out, that they had some form of concussion. And I've had an athlete come in who got knocked out, had no symptoms. So, obviously they're like, I'm fine. I don't have a concussion because I have no symptoms. But when I forced them to do the neurocognitive testing again, we saw that all of the reaction times were slower. So this is not a symptom that you would normally feel, right? It was a reaction thing. So we trained reaction stuff by using synaptic and vision training and things like that, where we got that reaction time back to what their baseline was. So in that sense, that person would have thought that person didn't have a concussion. I've had other ones that have had less of a knockout and they've had, hey, I have XYZ symptoms. I feel really fatigued. I'm moody. I have a headache, this, that, and the other. So I think, there's times that we can honestly say it's very different than boxing, where you're getting a lot of the repetitive head trauma. With us, it's a lot less forces because it takes just one time because of the small gloves. So you're getting less of that back and forth sheer, forces that are produced from like a boxing glove that's a lot more cushioned. So, I've seen both where I think, oh my gosh, that person had a concussion. And now I've seen other times when I'm like, actually, I don't think so. Their neurocognitive testing was better. They, had no symptoms. Like, okay, let's monitor them and see if anything happens. But otherwise we can progress them pretty fast back to sport.
Well, that's awesome. And it seems, and obviously you said you work with them year round. So I'm assuming having that baseline data has got to be really important.
It's really important. And I think, we're even doing a little more with EEGs and brain activity and things like that, because we've had athletes that have had those post-concussive symptoms further down the road, where they didn't have symptoms initially after a fight, but when they got back into training, they started having some. So we sent them to a group that we collaborate with EEG and looking at brain activity and realigning all the activity and everything like that, which I think is where the future is going to bring us.
One thing I think about a lot is just the ability for someone to identify whether they feel like they're about to be injured, or, I call it like an injury IQ. And do you think that athletes have developed an improved ability to identify when they might be injured or when they're not performing at their best, or with all this information that you're presenting with them? Or I guess like, what are your thoughts on that?
So absolutely. I think athletes IQ is super critical. I will tell you this, our combat athlete IQ are phenomenal, where they're like, I shouldn't have done that last round because I had that injury, or I knew something, like intuitively, they knew they shouldn't have done what they did, and then they get injured, right? So I know they're identifying that, hey, something's not right. I don't feel right. I'm more fatigued than normal. But as a combat athlete, they don't stop, right? Like I still have to go, okay, take that IQ, now do something with it, because every single one of you is coming into our office and saying, I wasn't going to do that last round, but this guy came up to me, or this person was going to show this new technique. I shouldn't have. So they're definitely identifying it a lot better. But now as the combat athlete, I need to reel them in and say, now stop. Which you're getting a lot more athletes, like I had an athlete come in last week that was like, I'm supposed to spar today, but I just don't feel great. I'm like, and he's like, I'm not going to spar, Heather. I'm like, yes, finally. So it's definitely getting more aware. And I think now they're starting to act on it, but you know how hard-headed a combat athlete can be. That's the last thing they want to say is, I don't feel right, or I don't feel strong enough, or I don't feel this, right? That's like, definitely not in their vocabulary, but they're getting better at it for sure.
Well, it certainly stinks, because it's like, in order for you to get better at it, you have to get injured over and over and over and over again to understand, like, okay, maybe I shouldn't do this.
A huge one is also that I see with us is training partners, right? Like so many times we're starting to teach our athletes, like, go with someone that also has an IQ of it, right? Like, don't just go with the one that's going to push you the most if that day you don't feel good. You know what I mean? So you can still train on a day. So we use Oura rings and stuff to look at trainability, recovery ability, adaptive, all that stuff. So like, listen to that. Listen to what, if you wake up and you're not feeling great and your data is like poor sleep, HRV is bad, body temperature is off, like start to go, okay, how do you mold your training schedule around that? Like maybe you switch up training. And that's one thing we're seeing with coaches, with us getting this information about our athletes, we can send a message to the coach and say, hey, their information doesn't look great. Maybe, and the coaches are now going, okay, I'm going to mold this. We were going to spar today, but you know what? Let me switch it and do technical training instead, or let's go over more drills and things like that. So they're starting to take all that objective knowledge that we're feeding into them and really doing something with it.
Are you working with the intensity in which like fighters are sparring? I know a couple athletes, like I think Sean Strickland is like one of these guys who he likes to spar hard,
Every day.
like every day
and all
hard.
day.
Right. But then you have like Max Holloway who likes to he likes to play spar, right? It's not this intense. So have you seen an adjustment to how some of these combat athletes are sparring based on objective information?
So yes, we've seen definitely some changes. I will say that our older population of athlete, like kind of is definitely someone that's learning that they might not need to spar as much as they used to. There's definitely something about that fight IQ, right? That they learned from doing a lot of live goes. So, you still see a lot of the younger guys doing a little bit more live goes and stuff like that. But then as they start to evolve and their fight IQ has evolved, they're definitely backing it off and they're definitely listening to more of that objective information. I mean, I think Glover's a great candidate of that. He was able to win a world championship. I mean, he literally came to us and said, I'm about to retire. I'm always injured. And, like, I just don't know if this is for me anymore. I'm getting older. And we literally made huge adjustments to his training loads. Also worked with his coaches to make sure they were getting quality, not quantity out of him. And then putting him on prevention programs for the injuries that he had so that they don't bother him anymore. We rarely see him from an injury standpoint. And he was probably seen quite frequently earlier on when we first started. And now he's really managed recovery, training loads, and it's great to see that.
Yeah, his last fight was unbelievable. I mean, he went to absolute war.
40,
I'm surprised.
like 44 or something. It's
I
insane.
know, brought him into
Crazy.
deep water and everything. It was absolutely wild. Do you think that the training age for MMA, I know like the NFL kind of hovers around the same age where it's like late 30s, early 40s is about that time, other than like Tom Brady and Glover Teixeira.
Right.
Do you think that training age is going to start to increase and maybe start to see fighters well into the 30s?
I do think we'll see that. Just the education and the awareness about, training and capacities and things like that is just evolving, that I think we will see a longer, spike. And I think we're seeing that across the board in all professions. Like we are seeing athletes be able to do a lot. One thing that I can say that we're really lucky is, we do see our athletes almost daily. Sometimes they're an hour session with an athlete, manual based, hands-on. We're seeing, when you have those capabilities, you can really make an impact on that athlete. And that's why you see a lot of, athletes that have big teams reaching out to outside providers to assist with their health and well-being, because they can give them the one-on-one time. And I think with that, we'll see athlete longevity just increase across the board.
Absolutely. Well, for therapists who maybe they do have a combat athlete and they don't know what they're doing, is there information for perhaps therapists to learn about combat athletes? Should they just go to a gym and try to learn the sport itself? I guess, I don't know if you do any combat sports, but I guess, how did you learn to, figure out how to adjust training volume and how to get the combat athlete back to return to sport?
Yep. So not only, I would say, at the Olympic team, I was really lucky because I covered a lot of practices, watched, spent a lot of time observing what the needs of the sport were in combat athletes. And I was really lucky to do that at the training center. Most physical therapists aren't covering sport coverage, but I was lucky to do that, to get, my feet wet. We also, when we first started, we had like Forrest Griffin teach us jujitsu. We had another staff member teach us wrestling. So we kind of all were doing classes every Tuesday and Thursday morning until we tore one of our colleagues' ACLs and we realized maybe we should not be so aggressive because we all have that competitive background. Sure. But we're constantly evolving and learning from our athletes. We're all, I would say the best knowledge is A, observing, B, talking to other clinicians that are in combat. We published 2 journals so far with a lot of information that's about injury athletes, like training loads, volumes, and all of these are free out to the public. You just have to get the link. I think our last journal, we started our first one with like 50 to 100 pages, and the second one is like 500 pages. It's like a textbook. Wow. So there's a lot of information getting out there and published, being a part of Ringside, going to Ringside physicians meetings and things like that, and learning what's out there. Those are all great ways. And then I think also, if there are combat gyms or MMA gyms in town, asking if they need assistance. You'd be surprised at how many of those athletes come from, no health insurance, don't know how to manage. So if you can get them at an earlier time frame, you're only going to evolve that athlete into more success.
Well, establish those those habits early, because again, you kind of alluded to this, like a lot of the fighters early on, they don't get this. Like they just maybe they join a gym, they start some local fights, and then they kind of go up the ranks, and maybe they get injured and they never end up seeing the top tier. Maybe they see Bellator, maybe they see, some other league, but if you're able to grab those athletes earlier on and you're able to get established with a gym, perhaps you can start to teach them, the right way about, injury IQ and identifying when they shouldn't be sparring as hard and so on and so forth. Now, again, you're not supposed to tell them when not to do things, but again, it's just being like, hey, I saw your shoulders been bothering you, or you didn't hit that jab as fast.
Yes, we could change this, or, let's work on a little bit. This is what you can do for your warm up. I love sliding rehab exercises into their warm ups without even them knowing, because to sit and do physical therapy exercises, I can tell you, they were like, I just did 5 sessions today, and you now want me to do 30 minutes of basic exercises? Like, come on. Yeah. But you throw that into their like warm-ups and their cool downs, and they don't even really know it. It's a great way to be successful with these guys.
Absolutely. Well, what about, I suppose, just in reflection to everything we talked about today, as well as, your career in the UFC, do you think that needs to be translated over to traditional sports, orthopedics, physical therapy? I know there's probably a lot of stigma that comes, from the UFC and also fighting in general, but do you think there's something that needs to be carried over from what you've learned as a clinician?
Absolutely. And I mean, I don't know how to educate more people. I think there's great social platforms in this day and age, so we can get a lot of education. I know we're trying to do a lot more educational pieces at the PI so that it gets out there on social media. I also know, I would love to educate more physicians, right? I mean, physicians still think that we count to 10, 1 or 2 or 3 times, and that's all we do. I've had athletes, they're like, oh, well, I don't need to start rehab for 6 weeks. I'm like, you're already 6 weeks behind, right? I see my rehabs 2 or 3 days after surgery. And that needs to filter down to general population organizations that, I think we need to change things up and educate the other medical providers around us of exactly how in depth our knowledge is and what we can actually do.
Yeah, I couldn't agree more. The amount of conversations that I have with patients where even I had a patient, they had a meniscectomy and they got the surgery, they took 2 weeks off, then they finally called, and then they were behind on we were backed up for visits, so he couldn't get in for another 3 weeks, and now they're 5 weeks back and they're post surgery, and they come in and their knees not bending as well as it should, and it's long, and they're like, why isn't this bending as well as I thought? It's like, you didn't come to PT for 5 weeks.
Right. Yeah. When I was at the Olympic Training Center, I had an elite gymnast in 2 weeks doing a double backs on the floor, and this is 2 weeks post-op of meniscectomy. Why are we treating this general population? If you can see them that first 2 weeks, and that brings up a good point. We see our rehabs twice a day, an hour a day, 5 days a week. So our rehabs are cut in half. Why aren't we doing that in the general population? Why aren't you preloading that meniscectomy for the first 2 weeks, and then they're done, discharged in 2 weeks? That's way less visits than 6, 8 weeks trying to play makeup. So I think that's something we need to do better professionally, is get the education out there to these physicians and these people that don't work in orthopedics.
Absolutely. And to your point earlier, it's why let's get people in to see a physical therapist first. If you had an orthopedic injury, you roll your ankle, you hurt your shoulder, go see the PT first, because honestly, they're going to refer you there anyway. And then, we'll be able to identify if something's worse than what it needs to be, or you need surgery or something, and then we'll refer you out. So
absolutely.
Well, Heather, it's been so awesome to have you on the podcast today. I know you got to get going and you're very, very busy. So I want to conclude with our podcast today with the final 3 questions that I ask everybody on the podcast. Hopefully, Are you ready for the questions?
I'm ready.
All right. First question. If you had the attention of everyone in the world for 30 seconds, what would you say?
I would say that you're never too old to learn. Keep people around you that are only going to build you up and learn from. Get rid of your egos on everything, put the hard work in there, and realize that the hard work and being able to learn from others is going to get you a lot further in life than you can even imagine.
Second question, what book do you recommend, whether a book you're reading now or in the past?
One of the books I actually just finished is Dare to Lead by Brene Brown. And it was a really good leadership book. And I think that's something that we're not really taught, not only in physical therapy school, but also in just general education. And I've had to learn a lot about leadership and building your foundation and building your team up. I wouldn't be where I'm at without the people that I work with every day. They build me up, teach me, train me, and also support me in everything I do. So I think it's really important to be a good leader, and it's taken me a lot to learn. And I've really devoted these last 2 years to try to improve that. So I would say that book definitely, I think, holds a close one to me because it taught me a lot of things to look at things differently.
Love it. And if people are listening and they want to learn more from you and find out you on maybe on social media, just provide some links that people can kind of learn from you and where you're at.
So all my links, I think, are my name, Heather Linden. I think my Instagram, I've just started a TikTok, which I'm trying to get into that stuff too, from more of an educational standpoint. But my plan, honestly, is to build out my social media in the next year and really get kind of the cool stuff that we're doing carried over to the general population and everything like that. So my first and last name, Heather Linden, is all of my social platforms and everything like that.
And I'll provide some links below so you guys can follow along as well. Heather, thank you again so much for coming on the podcast today.
Thanks for having me.